My name is Nick Green. I'm from San Mateo, California, and I have a very general question for the ophthalmologist, and it was, what's a typical day like when you come into the hospital and do your surgeries? I'm sure you could, tell us any specific details or any interesting things that occur.
I represent UMA Eye Clinic, which is and Vision Foundation, which is a non-profit trust of UMA Eye Clinic. We conduct regular eye screening camps for patients, and it's like we have 3 camps every week, and whether we have volunteers or not. And we go and bring the patients, and the specific thing is that we do phacoemulsification for all the patients, whether they pay or not. And this is possible through funding from Foresight. Basically, we have surgeries in the mornings, and if we go for camps, we do the surgeries in the afternoons.
Thank you for your question. In Ghana, when the volunteers arrive, we try to give them a bit of training as to how to identify common eye diseases. So we have about 2 days of training. Sometimes it can be extended to 3. And you move to your destination or where you're going to work. So when you come, we try to familiarize you with the environment where you're going to live. I think it's very important. You should know what food is available there, the sort of water, the culture, and possibly show you some interesting places that you may relax. Then, when the working days start, you come and we take you through the visual acuity for you to see in practice how it is done, taking the history of the patients that come, and then you see some few minor procedures that are done in the treatment room. You also work with the ophthalmologist or the ophthalmic nurses to see how we do our examinations and those things. And you can also go to the school to do eye screening. We also go outside the clinic to go into community screening. That is where you do a lot of work. So you do the screening, you identify the patients that you feel have cataract and some other diseases. And then the ophthalmic nurses or the ophthalmologist confirms the diagnosis, and they are asked to come to the clinic, or we transport them to the clinic, have the surgery done, and then we also allow you to observe the surgery. And then the post-operative care, you also do part of it.
My typical day, actually I don't want to scare you, but I'm in private practice and we assist United Foresight surgeries. So we go to the clinic in the morning, run our normal clinic, see the patients who have been brought by United Foresight volunteers, and then we do our surgeries in the afternoons. We start around 2 o'clock, and whatever number is available, we have to finish. But on 2 occasions, we had 32 patients. So we start at 2 p.m. and finish at 2 a.m. Since I'm the only person there, I have to do all. And they've come from far. We finish and they go home and come the following day for a review. So that is my typical day in United Foresight.
In addition to these programs, we in Chennai, for medical students, we have both side phaco training. So medical students who are interested in ophthalmology, we send them to 2 days of both side training, so they can get a hang of how phaco surgery is done, in addition to assisting the patients in cataract surgery.
What year medical students do you accept for that program?
We are a private clinic. We don't have any students.
I mean the volunteers, like what year do you have to medical school to go through the training?
we give them the good sci-fi training for 2 days if they are interested, in addition to going for the camps and assisting the surgeries. Because we had some volunteers who wanted to do surgeries, and so we started having this program also in addition.
It's all your medical students, they get a goat's eye and they're able to practice, do surgery. It's not an actual goat, but just the eye. And then they can do the surgery on the goat eye and chin eye. So that's a very special program we have there.
What advice would you give to a future volunteer to be the most, to enable you to be more proactive and the most productive on a future mission to volunteer at your clinic?
The question is, how can you best prepare to be a volunteer at the clinics?
It's like I start interacting with the volunteers 1 month before they come. So they send me regular emails as to what is the conditions which they are going to work, and maybe a bit of learning of the language once they come will help, because many volunteers felt that since language was a barrier, they couldn't do much. So only the basics like how to read the numbers and things like that. That should be more helpful. And it's like we mentally prepare the volunteers. Like they start interacting with me through emails 1 month before they come. So everything is well set when they come here.
I think in one way or the other, we try to encourage the volunteers to have a bit of knowledge about the anatomy of the eye, because when they come and you mention something like conjunctivitis, and some of them don't know what is the conjunctiva, whatever it is. So those of you who are coming in May and June, you were privileged to have Dr. Clark and the other doctor giving you some lectures in the anatomy. So I think a little bit of knowledge about the eye is very important. And then you just tune your mind to the community where you're going to. We know that it's very difficult for you to just see a shocking environment, something that you haven't seen before. So psychologically too, you have to be prepared. I think basically that's what I would say.
Well, I think I don't have much to add, except that you need to have a strong will, because some of the scenes, if you're not careful, you break down yourself before the patient.
Sometimes in terms of the language barrier, we usually have people who will be with you all the time when you are dealing with the patients. So you will have some sort of interpretation from somebody from the community who speaks English.
My question is to Dr. Sendil here. How do you combine a full private practice with the Vision Foundation? I know it's going to be really tough. And then how do you prevent people who can afford to pay for their surgery in your private sector going to the other end because it's free?
So the question is, how does Dr. Sentil combine the private practice with Vision Foundation, and how to ensure that patients who actually can pay for the surgeries are not taking advantage of the free services?
I think I'll answer the second question first. The government has helped us by giving an identity card to the patients. It's called a ration card. So when we see that card, we can sort out the patients who can't afford. It's a very simple thing. We ask all the patients to bring the ration cards. And when we go for camps, it's we know that what status the patients are living. So we go into the villages and see. So it's most of them are unaffordable, and they can't afford for fake emulsification because it's beyond their reach. And combining this, it's for the camps, the doctor doesn't go. The surgical work is done by the doctors of the clinic. So for the camps, we send paramedical ophthalmic assistants or optometrists. So they are well trained. We have a set of well trained optometrists who can identify cataract and even do the pre-operative workup like A scan and keratometry, everything. So surgeon's time is devoted only for the surgery. So by that way we can combine, and it's our aim is to do at least 40% of free work. We see 100 private patients, we want to do at least 40 pre-surgeries also.
I was curious what kind of educational programs were in place in different sites around the world and how students can get involved in education.
The question is about education programs in different sites and how students can become involved.
The education program, when I take my side of the world, we try as much as possible to have some health talks. You go to the schools, you go to some organized institutions, and I talk to them something about glaucoma, about cataract, how it is treated. Because some people feel that it's just their plight to having to be blind. So you have to explain to them. Some people too don't want to have anything touching their eye, a knife or what you call it, scissors or whatever it is. So you explain to them that cataract is something that the only solution is a surgery. And then most of them accept it. Then when it comes to trachoma also, we educate the people the need for clean environment, need for them to be clean, washing their faces, washing down, and all those things. So sometimes we arrange with some radio stations, they give us some airtime, you go there and discuss it. If you have a language barrier, you have somebody to interpret as you speak. So some of you volunteers can be of help in that aspect if you are really prepared to do it.
In the past ICAMs that we have been involved in, what we did is that before we started screening, we gather all those who are there, we give them talks. And the advantage in having volunteers from outside is that when you add your voice, that these conditions that they are having, it's all over the world, it's not unique to them. Sometimes it's very encouraging to them to hear that, and they are ready to then come forward for the treatment. So the students can play a very positive role in the education.
We have patient education pamphlets, it's details about cataract and glaucoma in very simple language, in the regional language. So whenever we go for the camps, we distribute these to the patients. So whoever is educated, they can read about it and explain it to the other people. And one more innovative approach which we do is whenever we go for a school screening, we educate the teachers, the school teachers, to do the vision screening. So for one time we go, after that the teacher does the screening of the students, and whoever has a problem, she refers it to our clinic. So it's educate, and the education is more complete.
Jennifer, more of a question for you and the producer of the film is that it will be available for distribution, for corporate fundraising, for nonprofit distribution. It's going to be on PBS.
Yes, actually, we will be taking orders at the registration table, and we have a number of copies also available as well that you can purchase now after that we've debuted it, and also tomorrow. So actually, it's a limited number that we have right now, so first come, first serve. Yes.
For Dr. Wanya and Dr. Clark, since you both got your education, some part of it abroad at renowned universities, what inspired you to go back to Ghana and remain there? Not only that, but continue to work with patients who otherwise could not afford or cannot afford their services. So it's easy to compare yourself to the other colleagues that you maybe attended medical school with, who are still working abroad and are doing much better financially. So what inspired you to remain in Ghana and continue to work there long term with these patients?
The question is for Dr. Clark and Dr. Wanye, who both completed their medical education abroad, Dr. Clark in Germany and Dr. Wanye in Russia. And the question is what inspired them to return to Ghana to provide the eye care?
Actually, when I finished my undergraduate, I had wanted to go back home straight away without specializing, but I happened to meet somebody who encouraged me and volunteered to sponsor my postgraduate studies in ophthalmology. So I realized that he was helping me to help my people back at home. So when I finished, my mind was a little bit divided. Go home or find a better place. But I had to think twice. And I know where I came from. And most people were blind and they didn't know that a simple cataract surgery will let them see again. So I thought that by going home and trying to also help a few people that I can was a wise decision, so I decided to go home. It's difficult actually going back, and you know that you are doing very tedious work. Where I'm working now, I'm the only one for over 2 million people. And sometimes I don't see my family for over a week, traveling and coming. If you compare the remuneration that I should be getting if I were somewhere, then it's discouraging. But then the satisfaction is there.
For me, I think maybe the most important factor was the challenge that was thrown to me by an expatriate. I did a basic medical education in Ghana, and after that I was working in a mission hospital run by Germans. And I was actually preparing to leave the country. And the challenge one of them threw to me was, they have come all the way from their country to help us, and they don't understand why we are leaving. So, in fact, it actually set me thinking. But then she also followed with a promise that if I tell her my interests and they have the means, they will help me. So when I went to Germany to do my training, I knew that I was going to come back and help. So I think that challenge was what motivated me.
Where do you get your IOLs?
The question is, where do you get your IOLs?
We have quite very good companies, indigenous companies, which manufacture very good quality lenses. We get it for around $1, which is a very good quality lens. $1, yeah. When you buy it in bulk, it's around $1 per lens. I get 1,000 or 2,000 lenses at a time.
What's the name?
It's called Appasamy. It's a very good company. He has been sending it to some African countries also. And it's a very good quality lens. We have used it for the past 8 to 10 years. And it's not a foldable lens, it's a rigid lens, but it's of good quality. And one of the eye hospitals which does around 3 lakh surgeries per year, but they use these lenses regularly.
Yeah, we get our IOLs basically from India because they are some of the cheapest on the market. If we have to buy from Alcon, our patients cannot afford to pay. And we also have some few NGOs that donate some of them to us. An NGO like Swiss Red Cross donates some IOLs, viscoelastic, and then sutures.
My final question for a private practitioner is very difficult because for us, we don't fall into any program at all in the country. So we just go around hopping from place to place, begging people, where can we get IOLs to buy? And wherever we find them, we buy. There's no regular system of ordering IOLs. So as I sit here now, I'm happy because last year, Jennifer told me about IOLs from Thailand, Sri Lanka, for $5. So I gave her some money and she bought some, so I hope to take them back to Ghana. They are 300 at least, it will last a while. But we have no routine way of ordering them. But at the same time, maybe we'll ask Jennifer to make an appeal also if people have cataract sets they are no longer using and things like that, materials. And apart from money and time, they can also donate them, we'll make use of them. Thank you.
Any type of equipment, used equipment that might no longer be used by ophthalmologists or optometrists is so useful in Africa and Asia. So if anyone knows of people who might have donated equipment, or if you have any equipment that you'd be able to donate, that would be wonderful. And I'd also like to recognize Alan Brown, who is coordinated to have Dr. Clark bring back some corneas to Ghana, and Dr. Clark is the only ophthalmologist in Ghana to provide cornea transplants. So we're very happy that he'll be able to bring some corneas back to provide some cornea transplants.